New survey shows 1 in 4 LGBTQ are thinking about suicide. LGBTQ plus have high rates of depression and other mental health issues. A first of its kind survey conducted in New York, released this week, found that nearly 1 in 4 have seriously considered suicide. As per the survey, transgender, gender-nonconforming, and pansexual Long Islanders were especially likely to report poor or fair mental health and moderate to severe anxiety or depression. Conducted by the Stony Brook Medicine division with 30 community partners, this is the first comprehensive survey of the mental and physical health needs of lesbian, gay, bisexual, transgender, queer, and questioning Americans. Survey organizers and LGBTQ plus leaders indicated. Lauren Magna, Public Affairs Manager for Planned Parenthood Hudson Peconic, said, quote, "The survey illustrated how distinct groups within LGBTQ plus communities have very different experiences and needs and are not a monolith," end quote. Stony Brook is taking a number of steps in response to the findings, including LGBTQ plus cultural sensitivity training for health providers and community-based organizations, the addition of LGBTQ plus material in medical student curriculum, expanding young adult and adolescent support groups, and the distribution of a directory of LGBTQ plus care providers and services. Trevor Project is another nonprofit organization doing incredible work in offering support in mental health, sexual orientation, gender identity, and more. They are reachable if you need help 24 hours a day at 866-488-7386. The study is shocking, but not shocking. We have been reporting all year in 2022 how difficult the 2 years of pandemic was, specifically on LGBTQ community and other marginalized communities. And now we're dealing with the political attacks that we have seen in 22 and the anxiety over what is going to come from that based on the midterm elections, et cetera. It's a time that we should all be aware of, and we should all be aware of our friends and family and our chosen family around us, because this is a very big issue. 25% of all of us have thought or are thinking currently about suicide.
That's so sad. Well, kudos to Long Island for implementing the training for healthcare providers, because that's just so important. You know, mental health is a real issue, especially in the LGBTQ plus community. There's a huge stigma, but aside from the stigma, also most people in our community don't get diagnosed, don't go seek the help that they really truly need. And that right there, it starts a spiral effect of depression, and you go down this rabbit hole that you really can't get out on your own.
Hey, I'm curious, why do you think that is? Your wife is in healthcare. Why does LGBT not recognize the mental health needs that we need? What do you suspect?
I don't think that it's that we don't recognize it, Al. I think that we're just truly fearful. When we go see those lab coats, the mental health people, when we go to anywhere to get any kind of medical care, we are not treated the same way once they know that we're LGBTQ plus, okay? Especially our trans brothers and sisters.
Yeah, for sure.
So they're not gonna go seek that help when they're ready just to get a tooth pulled or just to check for a common cold is difficult enough.
It's true. I mean, there are cases that I remember reading where the patients go into a medical facility and the doctor literally says homosexuality is part of their medical chart as an illness.
Oh my God.
This is, well, I'm not talking about something that happened in the 1940s. We're talking about something that happened in the 2010s. That's that shouldn't be happening.
And I'm sorry, and I'm not surprised at the numbers, as you said. I'm not surprised because I myself have been on the precipice of major depression for some time now, and I say that very openly, but because it's been very severe in the last year.
Why do you think that? Why? What implemented that for you specifically?
Well, you know, it's a culmination of so many things, like, you know, where am I in my life? All the standard things. I'm not enough. I didn't do this. Regret, because even though I don't believe in regrets, I'm riddled with them. So they
Mind you, nobody's done more in their life than Dale Stein. Literally, everybody at this table together, except for Al, probably will never mount up to what you have done. From Juilliard to Jazzercise to Unity on Debate to your opera singing. I mean, I can go on and on, people.
Yeah.
Are you Dale Stein's press agent?
I could be. I mean, he's done so much.
I guess my bigger point is that I've been so on the precipice, and it is a precipice, and you're like, if I don't remind myself of who I am and the support system I have and the people whose lives I know I've touched, and if I'm feeling that, then and when there are other people who may not be in my position, or by position, I don't mean by position, who have the support system, then certainly those numbers are higher.
Yeah.
That was my point, really, not to say that, but.
And, and yes, it is certainly more pervasive in the LGBTQ community because we are discouraged from getting help. But America in general discourages people from getting help. We're here to treat here down on our insurance. But what do we need to get supplemental for? For dental, for eye, and for mental health. Yep. And mental health is not, as you're aware, I'm very aware, but I think we're all aware, mental health is not quantifiable. If I have cancer, I'm going to be able to see it, or feel it, or see it on lab results. You can quantify it. You can know which type of cancer it is, but you don't know what type of mental health issues you have. And it's hard to get into, and we're at a disadvantage just being in the American healthcare system, and being LGBT, I believe, True. Adds layers to it.
That's that, and the fact that, for example, there are several approaches to mental health. Obviously, there's psychiatric. In that case, they prescribe medication for you, and then there's psychological, which you go to see a talk therapist, or other. The problem with quantifying those issues per insurance purposes is that how do you quantify talk therapists? They want to know how long you need it. They want to know how much it is. They want to know, insurance companies want to know at the bottom line, how much are they paying for it so that they can jack your premiums accordingly.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Lara are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.